Kumiko Sakai Kato from the National Institute of Health in Japan to give us an update.
So you also.
Okay.
She will start as soon as Good afternoon. I'm very glad to be here again. So I'd like to update the activities of regulatory science research for nanomedicines at Japanese National Institute of Health Sciences. So to provide an environment that facilitates the development of innovative drug products, it is essential to develop suitable product evaluation methods and to issue assessment guidelines and documents detailing considerations to ensure drug quality, efficacy, and safety. To that end, the expert in Japan has been examining the evaluation of nanotechnology-based drug products with the support of research grants by the Ministry of Health, Labor, Welfare, and Japan NIHS, the Agency for Medical Research and Development, AMED. So the exchange of non-confidential information between international countries are also important. So these are guidelines and reflection papers specific to nanomedicines recently published from Ministry of Health, Labor, Welfare, MHLW. The first one is a joint MHLW-EMA reflection paper on the development of block polymer micelle medicinal products. The second is MHLW guideline for the development of liposome drug products. So in light of the research development of multifunctional nanomedicines, these two documents include points to consider for nanomedicines in which the surface is modified with targeted molecules such as a ligand or antibody. The third one is a reflection paper on nucleic acids, mainly siRNA, loaded nanotechnology-based drug products. So MHW communicated with foreign regulators in the process of drafting these guidelines and reflection papers. So you can get the English translation version from the website of NIHS. So let's take a look at the ongoing research activity concerning the evaluation and quality assurance of nanomedicines at NIHS. The objective of this work is the development of an evaluation strategy of nanomedicines from a standpoint of quality, efficacy, and safety. Nanomedicines are mainly developed for control of biodistribution of APIs, so knowledge about the relationship between each element shown here is important for ensuring efficacy and safety of medicines. So especially knowledge about biodistribution is considered to be key. So as one of our researchers, we conducted a case study of analyzing the critical process parameters and critical quality attributes of nanoparticle formulations by using the quality by design QBD approach, which was published in the scientific journals. So another study is about the quality attributes affecting in vivo product performance of liposome and the development of analytical methods of the quality attributes. So I will introduce our recent study about the membrane rigidity of liposomes. So we developed the analytical methods of liposome with different lipid compositions in an aqueous medium by using AFM and show that membrane modulus can be one of the parameters of the membrane rigidity of liposomes. So we also found an inverse correlation between the membrane bending modulus of some liposomes and the permeability coefficient of encapsulated module drug. We also demonstrated that the efficiency of penetrations of liposome into three-dimensional spheroids increased with the bending modulus or membrane rigidity of the liposomes. So this study indicated that membrane rigidity measured by AFM can be one of the quality attributes affecting the in vivo performance of some liposomes. So we are further conducting studies for validating the analytical method and the studies whether this method can be used for compatibility assessment of liposomes. So our future issue is the standardization of revariation methods for nanomedicines. So this includes the assessment of precision. So for example, the precision between laboratories, collaborative studies, which is usually applied to standardizations of analytical method, will be required. So thank you very much for your attention.
Thank you, Kumiko.